Salam and hello everyone. Welcome back to the channel. I hope that you are all doing very well. In today's video, as you guessed it, we are going to be talking about why fibroid size matters. So the first thing I'm going to do is I'm going to provide you with a little chart that helps you get your mind around what fibroid size looks like in comparison to fruit. So I'm going to share a chart with you that looks at the different sizes compared to fruit. So we're talking about the smallest size that has been seen clinically all the way up until the largest size that has been seen clinically in patients. I want to talk to you about when these symptoms typically start in comparison to fruit. And then I want to talk to you about why it really matters, because some of you who have experienced fibroids have either been treated or you've not been treated. And it depends on a lot of things, including your symptoms, fibroid size, whether you're trying to conceive. So there are a lot of things that are at play here, which I hopefully can dive into in this video. So if that is something that is of interest to you, please keep watching. So first, let's dive into the smallest fibroid size that has been seen, and that is fibroid size that is less than 1 centimeter. And here we are talking about apple seeds, for example. Now, these are generally asymptomatic. No symptoms have been seen in women who have experienced fibroids typically it's found through imaging, ultrasound, MRI, but this is typically the smallest size fibroid that have been documented. Now, typically when we're talking about 1 to 3 centimeters, we're talking about walnuts, cherries, grapes. These fibroids typically don't have symptoms, but some women may experience some off bleeding, maybe heavier than normal, but typically these are also asymptomatic. The bleeding may not be anything outside of the normal bleeding from the menstrual cycle. So that's something to keep in mind. Also, you should consider where the fibroids are found. Fibroids can be within the uterus, within the cervical lining, outside of the uterus, around different organs around the uterus. So it's important to keep that in mind when we're talking about fibroids. I know I've spoken about this in the past, but typically fibroids can be found in different parts of the abdomen region. Now let's jump into fibroids that are between 3 and 5 centimeters. So these fibroids are the size of a plum or a small kiwi, and they are more likely to cause irregular bleeding as well as mild symptoms within the uterus, which please check out this mild symptoms within the abdomen region. Excuse me, I don't want to misspeak here. So please check out this video here where I talk about those symptoms of heaviness and bloating and just abdominal pain and pelvic pain. It's going to be important for you to recognize these symptoms. Now let's jump into large, or what's considered to be a large fibroid, and those are between 5 to 10 centimeters. They are an orange or a grapefruit size, and they often cause menstrual changes, pelvic pressure, urinary or bowel symptoms. Most clinical guidelines use 5 centimeters as a threshold for increased risk of symptoms or pregnancy complications. So that's why I put here, typically many women do start to experience symptoms when they're at this particular point where their fibroids are between 5 and 10 centimeters. And then finally, let's jump into the last size of fibroids, which is between 10 and 20 centimeters. Now, these are very large. These are considered very large, and they're anywhere between the shape of a mango, a cantaloupe, or a watermelon. And for symptoms, I put flat out yes here because these can cause obvious abdominal changes like abdominal enlargement, significant pressure symptoms within the abdomen region, within the pelvic region, and typically women may need surgery or other interventions at this point in time. Fibroids can rarely grow to enormous sizes, but I think when I had read the evidence or the clinical presentation of one of the largest fibroids, the largest size fibroid that has been documented to date was 61 pounds in a menopausal woman who was living in Singapore. So please keep in mind that there are a variety of sizes of fibroids, and that's something you're going to want to be cognizant of and careful of. And fibroids do grow, and they can, and there are there are sometimes excised in multiples from different women around the world. So that's something to keep in mind. Now, when we're talking about when symptoms typically start, please note that this is what has been presented clinically amongst different patients in different parts of the world. So women are coming to the clinician, to their clinic, they're complaining of abdominal issues, pelvic issues. Fibroids has been diagnosed via MRI, ultrasound, and this is what's normally seen. This is what has been seen, in women who are coming to the clinic. So often when a woman has many seed or grape-like size fibroids, 1 to 3 centimeters, the fibroids cause no symptoms. Many of you have probably seen it in your ultrasound during pregnancy, and your physician decided not to treat because it wasn't causing you any complications with the pregnancy or after the pregnancy. Now, when we're talking about mild symptoms, you're looking at the size of a plum to a small orange, anywhere from 3 to 5 to 10 centimeters, and many may see heavier periods or mild pressure depending on location. Now, clear symptoms where organs are being affected, we're talking about large orange or grapefruit size. So that's 5 to 10 centimeters. So more than likely, this causes urinary frequency, constipation, visible abdominal changes, and more significant bleeding. Clinicians commonly flag, as I said before, 5 centimeters as a size where monitoring and treatment starts to happen, and the conversations become a little bit more present during the clinician visit. And then finally, we're talking about severe and urgent. So this is anywhere from 10 to 20 or more centimeters. And we're talking about, again, mango and watermelon size, which is likely to need intervention for symptoms. So you can have symptom relief, including quality of life issues because of mechanical complications. So difficulty moving, difficulty perhaps urinating, going to the bathroom, having constipation issues. So this is where treatment it becomes a little bit more pertinent and present. Now, let's talk about 5 reasons why size matters. We're talking about, number 1, pressure on nearby organs, specifically the bladder and the bowels. When I talk about urination and constipation, those are serious issues, and those can have significant long-term issues if they're not treated accordingly. So that's why it's going to be important to address the fibroids, because you don't want to have not only your uterus impacted, but also your bladder and your bowels. So it's going to be important that you know that overall treatment considers other organs that are involved. Secondly, we're talking about heavier and longer periods. Typically, periods can last anywhere from 3 to 8 days with normal menses. However, when women have fibroids, they're looking at periods that last longer than 7 days and that are more heavier. Typically, when you start your period, you start light, heavy, light. It goes to a little bell curve. But one thing you need to consider is that with fibroids, bleeding might be consistently heavy and it might be longer than normal. So that's something that's going to be, you're going to need to take into consideration. About 30% of women with fibroids experience heavier menstrual bleeding. And then number 3, we're talking about pain and sexual discomfort during intercourse. So bulk or location can cause pelvic pain or pain during intercourse. Larger masses are more likely to cause that persistent pain. So earlier I mentioned that there can be fibroids within the cervical lining, and that can contribute to some of this pain. And then we also need to talk about fertility and pregnancy risk. Fibroids greater than 5 centimeters, multiple fibroids, and those that change the uterine cavity can increase risk like miscarriage, preterm birth, or labor issues. So clinicians often pay close attention to these situations with women who are either trying to conceive or who are pregnant. Now, let's talk about the impact on daily life and treatment decisions. Very large fibroids are more likely to need a myomectomy, a hysterectomy, or uterine-sparing options or embolization. Size helps guide which treatment is safe and most effective for patients. So I talk about that specifically in this video here, so give this a watch when you have a moment. So So there are often times when you will want to tell your clinician or reach out to your clinician if it's outside of the normal annual visit. So very heavy bleeding or dizziness, lightheadedness, or signs of anemia, rapid growth, meaning your abdomen is growing bigger and bigger and it's not due to food. Another thing is severe urinary retention and inability to go to the bathroom or pass a stool, meaning you're constipated. Also changes that affect fertility, planning, or pregnancy. If you're having multiple miscarriages or recurrent pregnancy loss, or you're having infertility concerns, that is a sign to reach out to your physician. And then also think about fibroid growth after menopause, which is very unusual. I've talked about that, specifically this topic in this video here, whether or not fibroids shrink after the age of 40 or 45, which is typically the onset of perimenopause and menopause. Some women are expecting their fibroids to shrink along with menopause coming on, but that's not always the case. So I do want you to take a look at that video here to get a better understanding of why that may or may not happen. So I know this was a quick video, but I did want to just give you a lay of the land of fibroid size, why it matters, and what to look out for symptoms, and why or why not your clinician may decide to treat. So let me know in the comments if this information has been beneficial for you. What else you want me to talk about fibroids? I have a long list of topics to bring for you on fibroids and not on fibroids, other health topics. So I do hope the information in this video has been very beneficial for you. I thank you for watching, and I shall see you in the next video. Take care. Bye.